Okay,
Okay.
now it's functioning.
So we will have 3 inputs the next 45 minutes, presenting local cases and perspectives on this new research and practice of Diaconia. And we will start with Nicole Borisuk. She is going to talk about the relevance of research and practice, the experiences of the FBO Living Hope from Odessa in Ukraine. And Nicole, she is a German social pedagogue who founded, together with her husband, the Christian faith-based NGO Living Hope in Ukraine in 1999. And they have established daycare centers for marginalized children, young people, and families in disadvantaged urban and rural areas. And after the start of the war in Ukraine, she established and led work with Ukrainian refugees in Germany for 15 months before returning back. So we are very, want to say a very warm welcome to you, Nicole, and I give the word to you with 15 minutes. And along while she's speaking, what we will do is that we will have questions for clarification after each presentation, but the main big questions we will save for the panel discussion at the end with the speakers. So the floor is yours, Nicole.
Thank you very much, Lina. Yes, my name is Nicole Borisuk. I'm German by birth and Ukrainian by heart, living in Ukraine for 27 years, which with a little break from February 22 till June this year because of the war. Everything I want to share today is from projects before the Russian invasion in 22. But of course, the approaches and the methods we use in our daily work right now have not changed. So we keep to our conviction that participation and empowering young people and children and families who face exclusion are crucial in diaconal work. Introduction, you have already heard that we are a local or regional, I would say, NGO, working mainly with excluded young people, families, and children. Before the war, we had about 120 participants coming to our centers daily. But of course, after the war started, we had to change our context because the context changed very much. But we are still convinced that you can really create meaningful projects in small neighborhoods that can make a change. And it's important to listen to the voices of the people who live in these areas. So for us, participatory contextual research is a key element in developing meaningful community projects. It was always on our heart not to do donor-driven projects or projects who would be delegated from the outside, telling what people have to do and how they have to function in a context that is mostly unknown to the donors or to the sponsors. For us, it's important to be in the place and to listen to the people who live in these places. We want to bring experts by life and experts by profession together. For us, the experts by life are the children, the young people, and the families we work with. People, actors, and stakeholders in the context. So it's a process of mutual learning, a careful listening to each other, and not just pretending, listening and coming with the attitude of, I have studied social work or sociology, so I know how to do it, but really seeing the value of the people who live in the context. We are all learners, and the attitude is crucial in this kind of work. So I want to share with you a small project we have done. Maybe it's not small because it has changed the life of many families in this little village. It's a village in Ukraine, 60 kilometers east from Odessa. Odessa is a big city in the south of Ukraine. And we had already 2 daycare centers in our city of Odessa. And we were invited by the local government of a small place. They have about 5,000 inhabitants to also come and work with the young people in this place. But this time we decided that we really want to learn from the young people in that spot. So we when I speak about we, I speak about not only the team of professionals, but also young people who had experienced our centers in Odessa. So we as a team went together to the village, and we had several meetings in the local school with young people, adolescents who lived in that context, because we had just presumptions, but they are experts in the field. They are experts in their village. They know what is needed there. So we had a kind of focus group meeting, and we were just asking questions. And one question was, what are the issues in your place? What are the burning issues? What are the problems? And they wrote it down. They made kind of brainstorming and discussion about it. And then they came up with these top 10 issues. And one was pollution of the environment, because they didn't have a place where the garbage would go, and it was all over the place. But second came poor and dysfunctional families, alcoholism, drug addiction, no place for meeting for young people, no playgrounds, and so on. And at the second meeting, we were asking questions: what ideas you have to tackle one or more of these issues? And they were challenged to think what we can do in our place and where I'm personally willing to do something. And this ended finally in some practical work, that we were all cleaning together the territory of that village. Finally, we were able, with the help of these young people, to renovate an old building and establish a daycare center for them. And also, you can see on this picture, this daycare center, what is very well visited before the war. Right now, we had to stop working because of the bombing. But yeah, it's still there, and we hope to re-establish the work after the war. And also, we could build this wonderful playground in this village, but it was all initiated by the young people who live in that place. So listening to the voices of young people is very essential to our work, and it's something that we feel very much passionate about. So we were also able to participate in a project organized by Interdiac, which was already mentioned, the organization. Here it was called Listening to the Voices of Young People. And we did some focus group work where we were listening to the young people who come to our services, who are part of our services, but also to the team. It was a project with 6 countries attending from the former communist background: Armenia, Ukraine, Estonia, Georgia, Slovakia, and Kyrgyzstan. And we were all from rather small NGOs working in this field, doing focus group and individual interviews with the young people who are coming or working in our centers. And we took the voices very serious. So we asked very serious questions, because we wanted to find out the state of diaconal youth work in our places, and if the work we do right now is really relevant for the young people and for their daily life. And what was very interesting to hear after we, of course, it was a very time-consuming project, because we had to translate everything into the local languages, not only language-wise, but also academic to everyday language, so the people we work with would understand what we really want to know. And we were the kind of facilitators of the process, and we were learning a lot ourselves during this research process. And what we could find out is why young people come to our places, why are they valuing this kind of work, is because they feel accepted, they feel that their social inclusion is getting progressed because we support with living conditions and also with medical help and also with education, which is very important for the young generation. And they feel empowered in our places because they are participating, they are belonging to the community, they feel needed in the community. And for the workers, it was more important to serve as an example to the younger generation. And that was also important to hear for us. So the whole research project actually ended or led us the way to a very empowering project which followed up this research, which is called Make Change Yourself, where we brought together professionals and students and voluntary workers in the youth field from different countries. And in a training program, we could give them the relevant knowledge to work in their places for change, including a lot of participatory methods. So research helps not only to evaluate diaconal work, which is very important, but also to adapt the life world of the people to our diaconal settings. So for me as a practitioner, it's something very essential in our daily practice. And age is not a hindrance, but you can even do participatory research with very young people. Thank you for your attention.
Thank you so much, Nicole. Thank you. It was very interesting to listen to you. I don't see the presenter. Tromp is going to talk about the topic of voicing the people in least powerful positions, an example from research in drop-in centers in the Netherlands. And Tromp is an endowed professor of Diaconia at the Protestant Theological University in Amsterdam. And he chairs research focuses on the contribution of diaconal practices to the inclusion of people confronted with social exclusion. So I'll give the word to you now.
Can you hear me?
Yes.
Yes, and can you see my presentation also?
Yes.
Yes, okay. Thank you, Line, for introducing myself. And this presentation is indeed about, about the space of meaning in drop-in centers or walk-in centers in the Netherlands. And by presenting this case, I will highlight some of the lessons we learned doing research in diaconal practices, especially the contribution of the people in the least powerful positions. They provided us with surprising insights on the importance of using different perspectives in diaconal research. At the same time, we noticed that the influence of external factors in conducting such a diaconal study can be powerful and not easily to resist. Well, the reason to initiate the study was a new governmental subsidy for spiritual caregivers to provide spiritual care to people in home situations. In the Netherlands, spiritual care is restricted to the care for people who are staying in healthcare inside healthcare institutions. Nowadays, fewer and fewer people with illnesses or disabilities are staying in these institutions due to budgetary reasons. They stay at home as long as possible. And this leads to increasing loneliness and existential problems. Because the Netherlands is a highly secularized country, and because there's a strict separation between church and state, pastors from churches can mean little for these people. That's why after years of lobbying, an experiment has been started with a governmental subsidy for spiritual caregiving for people in their home situations. And this experiment was very successful, but also invoked some jealousy by diaconal workers. Diaconal workers were not eligible for this subsidy. In their eyes, This is unjust because they have been assisting people who are confronted with loneliness for decades. That's why the board of the Association of Diaconal Drop-in Centers in the Netherlands thought it a good idea if there would be a research project on the contributions of drop-in centers to spiritual well-being of their visitors. If could be shown that this contribution is substantial, then they could make a plea for a subsidy to the government as well. In the background of this question is the continuing struggle for sufficient financial resources to keep these facilities running. Drop-in centers or walk-in centers are kind of shelters. They are small-scale and very accessible places intended for people who do not have a social network or who feel lonely, like older adults, people who are chronically ill, or people with mental or physical disabilities. The drop-in centers offer space for meetings, having coffee or tea, for group activities or sharing a meal, having a chat with a diaconal worker, and so on. Visitors can also get help with practical problems, especially with filling out forms or for mediating problems with agencies. Most of these drop-in centers are rooted in the Dutch urban mission tradition. In some of them, this religious background is still noticeable. The initial objective of the research project was to find out what diaconal practitioners contribute to the spiritual well-being of the visitors, of their meaning making, as a means to demonstrate that their work was comparable with the work of the professional spiritual caregivers in home situations and therefore acceptable for applying for financial support. The funding of the research project, for this research project, the funding was obtained from a number of funding bodies, which also financed the association and which also subsidized many of the drop-in centers. Their importance, the importance of the funding bodies, was clear. If the government, on the basis of specific contribution to meaning making, were to support these drop-in centers, it would be a financial advantage to them. The director of the association asked me, as being a professional at the Protestant Theological University, to conduct this project. And I had an interest in it because I did not do any research in this practice before, and also I have an earning assignment. So making a little money was attractive for my position. And that leads to the first reflection. This project was conceived and initiated by board members and the director of the association, together with the directors of the funding bodies. Financial motives played a major role in the conception of this project. It is the people in the most powerful positions who initiate this investigation. The premise that the drop-in centers are valuable for the existential well-being of the visitors is beyond doubt. It is an interesting question what would have happened if this proposal had first been discussed with diaconal practitioners. What would they have pushed forward as a relevant topic for research from their perspective? Does existential meaning have any urgency for them? What if the directors had put a question of financial support to the practitioners? And what would the project be like if the visitors of those drop-in centers were asked what research on meaning would be relevant and urgent to them? All those questions were not being asked. So after the question came to me, I asked a number of questions to the initiators of this project. Is an outcome different from what you acceptable? Can we use a broader conception of meaning in which not only the spiritual, but also material, physical, and social aspects play a role? May I ask practitioners to conduct the research? May I ask visitors and volunteers to join the research? May I start by putting the questions to visitors, starting with the perspective of the people involved, the people in the least powerful positions, and is there room to adjust the design after a conversation with them? And I received all the space to change those elements. We selected 5 drop-in centers to conduct the research in. The research was conducted by a practitioner researcher, a diaconal worker of a drop-in center himself. We did not succeed to involve the practitioners of these drop-in centers we selected. They had no time and no skills, according to themselves. According to them, research is not part of their job. Moreover, I sensed a little suspicion to research. Just as Tony Eddy said, research yields nothing that results in a report that remains on the shelf. It's a waste of money. You can't live in research, but you can live in a drop-in center. We started with interviewing 3 visitors for each locality, and after analyzing these interviews, we conducted 3 observations in each locality. Finally, we interviewed 2 volunteers and 1 professional in every locality. And this leads to the second reflection. The suspicious attitude of professionals to research. Mind the reported lack of time of practitioners. And mind the self-assumed lack of competence of practitioners. I wonder what would have happened if the practitioners were invited to participate in the design phase of the research right from the beginning. I think it would have been a major change to this project. Then I will present at last some of the results of the project. The interviews with the visitors were the most surprising part of the results, and I'm so glad we started with them. The first thing that struck us was that filling in an informed consent evoked resistance to a number of respondents. These respondents hate forms and signatures. Forms appear to them when things turn out bad. For the researcher, this was an important signal. By conducting research according to the rules, we also did introduce the formal register, the logic of formality, that does not evoke confidence to some of the respondents. The second striking thing was that many visitors made it very clear at the beginning of the interview that they did not attend this drop-in center because of any problems. They just happened to come by once and then decided to stay. This was also an important signal for us as researchers. Many visitors are extremely alert to stigmatization that comes with it when they are framed as somebody with an issue. Trying to keep out of this frame is very essential for the visitors. The third surprise was that they couldn't do nothing with terms like existential or spiritual well-being or a meaningful existence. "Can you put that in plain language, please?" said one of the visitors. After we changed the question in "what's important for you," they reported, well, having coffee together, sharing our meal together, having fun together, talking with each other, listening to each other, doing things together, celebrating together, helping each other with practical issues, and so on. One of the visitors put it very clear. "It's all about the people, sir. it's all about the people. The next interesting result was that this together was not always that harmonious. We are people from different backgrounds, you know, said one of them, and another said, you need a lot of patience to bear each other's special character and behavior. When asked about religious support, they reported that there were prayers and sometimes a candle was burned or a Bible discussion group, but that was voluntary and they did not need that for themselves. Finally, it was striking that the volunteers and the professionals appeared only in the margin of their interviews. In some of the interviews, the volunteers and the professionals were really absent. It was all about their own contribution to the practice. And finally, the response of the professionals I will present to you. They were pleased that especially the visitors revealed the unique identity of the drop-in center. And they were relieved that spiritual care did not turn out to be the guiding principle to characterize the uniqueness of the drop-in center. Because spiritual well-being is coming from the logic of individuality and not the logic of communality. And the logic of communality is essential to the unique identity of those drop-in centers. They were happy with the role of the researcher practitioner. This really promotes a better understanding of what matters. And they were finally surprised by the extent to which the visitors feel ownership of the practice of the drop-in center. They really didn't know that they feel, in that sense, owner of those practices. That's what the professionals strive for, but the fact that many of them also experience it in this way was a boost for them. So this is my final sheet, and the third reflection. Mind the benefit of starting with people in the less powerful positions, the people concerned. Mind the courage to resist the agenda of the people in the most powerful positions, in this case, financial driven. And mind the value of the practitioner's perspective. Familiarity with the practice helps to get a clear picture of the uniqueness of the practice of these drop-in centers. So my final question would be, what do we need to entice practitioners to do more research in their own practice? Thank you.
Thank you so much, Thijs, for your very interesting presentation with very important. The last presentation will be the pedagogy for research and practice, and will be presented by Oksana Prosvirnina. She is a Ukrainian educator who is in the moment is residing in Manchester after the war in Ukraine. And she is also a program leader in interdiac, International Academy of Christian and Social Action in Central and Eastern Europe. So I'll leave the presentation for you now, Oksana.
Thank you, Lina. Can I ask if you see my presentation?
Yes. Can you also put on your video so we can see you?
Yes, also? Definitely. Sorry, yes.
Can you click on slideshow, Oksana?
Yes. Let's a bit on a issue. I don't know why it doesn't come to the slideshow. Yeah.
Beautiful.
Thank you. So thank you so much for these contributions, and I think this is my input comes in as last input, and I want to draw your attention to pedagogy for research and practice. And in a way, I'm building up a bit this input from those reflections which you have already heard today, but also I would like to share my own experience, and it would come in a way, in a two-folded way. First of all, as experience as a person who was graduated in sociology quite extensive knowledge, which was very much challenged by the changes in my country, which were happening all the time. And it was creating quite a bit of confusion with me. And second, I would like to share with you the experience as an educator who is involved in learning, which we are developing in interdiac to support diaconal practice in Eastern and Central Europe. And it's a very interesting field because, as you might know, there was no kind of that much developed diaconal work until the collapse of Soviet Union. And it was a very interesting learning with the people who wanted to build their presence in the field and work with marginalized people, but also reflect on their role. And we have been doing it in interdiac for quite a while, and we had already a few programs from which we can draw some of our conclusions. And another approach which I would like to involve into my presentation is experience of cable, which is a method which was developed by Tony Eddy with his Finnish colleagues, and this abbreviation stands for Community Action-Based Learning for Empowerment. So I will, in my presentation, I will aim to wrap up a bit some of the conclusions which we heard from today, and also elaborate a bit on the learning for pedagogy, which can be helpful in thinking when we want to develop research and practice. And I want to start first with looking back and saying that there are some basic commitments for practitioner researcher, and vastly they are rooted in idea of social justice. And when we think about social justice, it's not only about the value, but in our work, and I will talk about our work quite a bit because I embed myself quite consciously thinking that this is also part of my practice to work with people who then will be working with marginalized people for change. So in our work, we could think about taking social justice also as a useful guidance, which can help us to analyze the situation together with the people from the angle of social justice, which is present in their situation. And this is always something that they bring from their everyday experience with their everyday insights and highlights. And it can be always revealed to us as a process of learning together with them. The second approach, which I want to bring into the commitments, is very much important for us when we think about approaching working with people as experiencing our work with them, seeing them in a holistic manner. Because as we might have heard for quite a while, that we even struggle with the language when we talk about people as service users, or talk about to them as beneficiaries, is very much a language which puts them in the position of being categorized, as Tony said, or labeled into some of life situations where they already struggle. But when we take the approach of seeing people holistically in their life world, we also experiencing the opportunity to look with them and starting work with them from their strengths. And this is something that I think opens up the possibilities for a transformative practice. And if we link this together, these two basic commitments, then we can say that starting with people for transformative practices, seeking the orientation of social justice, we can then expand this work towards bringing the issues of social justice to the society and embracing these levels of social changes which might raise to political changes as well. And it's quite important now to say that we should recognize that if we don't do that, if we stay on unreflected interventions, That basically means that we may destroy a very important aspect of personal lives, life of the communities or localities where we work. And also it keeps people in diminished positions. So having said that, I would like to come to the main question of my presentation. What pedagogical approach do we need to support practitioners and enable them to recognize themselves as researchers, and what skills and knowledge would be most appropriate for everyday practice in the field, experiencing it as a research. And I would like to say that here I will draw for some ideas from our experience, but also from pedagogy of Paulo Freire, because we found that this pedagogy is, like I would say, the most adequately can embrace the challenges which practitioners are facing and can be very helpful to build the connection with those people whom they worked with. And what I would like to highlight as the main ideas for pedagogical framework is connects us to idea of being of creating some kind of a service model for the practitioner, which should be actually addressed holistically, so that the practitioner will feel that that they are kind of confident in what they know and can bring it on to the practice. The few points which are here is first of all is that we should develop learning processes where practitioners go out and stay in the field as active learner with the people. And as it was already mentioned, in a way, this first-hand experience is very important because it creates some validating to the tacit knowledge which a practitioner experiences, but maybe sometimes doesn't reflect on. And it can go even through the bodily senses of the space where they present with the people. And it also contributes to a lot of informal learning which comes from them. And then, of course, we should think about the service model, which would be primarily constituted in the experiences of those and with the experiences of those whose issues, needs, and questions are being addressed. It should not come from the institutional formative prescriptions. It should not come from some legal framework provided by governmental bodies. It should come as a way from not from top down, but from down to up top. And as it was already said, to keep the critical angle of social justice, asking every time, as what you heard already from our contributors, with whom we are developing processes, whose perspective we are pursuing, whose interests are at stake, who are stakeholders into this process. So this, I think, is very critical, and this has been very much explored also in sociology of oppressed, suggested by Paulo Freire. And to achieve it, it's actually important to say that together with people who are beneficiaries, it means to actually for us to reflect on our position and come into the process of working with people as a learner, supporting horizontal relations with them, because these are those relations which also contribute to trust building and to developing mutual exchange of knowledge between people, where people really see that they are not labeled, that they are perceived as they are in their living world, and thus they feel that their voice is heard and their agency is empowered. And I have listed a few knowledge and skills which I find, we found in our development of the learning as very important, and there is a number of theoretical approaches in the field which are helpful to develop and support this kind of learning. There are a few of them. I will not go into them in details because of the lack of time, but I would like to highlight some of those which can be can be actually thought of when we think how we can modify with them our approach to practice. And this would be something that I would like to explore in the last few minutes of my presentation. So first of all, I would like to start with the person who is a practitioner and who appears and finds themselves in the living and comes into the living world of the people. And it's a very ambiguous and confusing position because we don't know them, and we have quite a bit of a knowledge which is actually not telling us much when we get into the living world. So it's of utter importance to think how we can empower a worker to connect with people, but also to connect to our own biography, because biography is our resource. And it's something that actually informs our expectations, what we want to achieve in work with people. And you can read more about clarifying this approach in the cable approach. And it's also one of those moments when thinking about the position of the worker, we want to develop the kind of resistance, what Thijs said, to assimilative strategies when the learning with the people is neglected. And then it means basically that we are recreating empty knowledge. What we need is actually together with the people say, we know that we don't know, but we are here to search for new approaches with you. And in this way, actually, research can be integrated in the practice as an essential part. And it means that actually it also a priori in a way involves participants as co-researchers and volunteers and activists as co-researchers, because we are all co-creators in this process. And we in this way create sharing agency of people who share also their experiences and developing transformative practices which are challenging the situations if with recognizing social injustice and with bringing ideas how it can be challenged. And on my last slide, I would like to say that there is kind of a few moments which I would like us to have maybe later on some reflection on. So what we found out, and it was in a way implicitly mentioned in our discussions, is that such approach means that it's active embedded presence with the people, but it also means that very often practitioners are challenged by it because there is project framework, and project framework pushes on us a framework of time, which is very much driven by effective cost norms, while when we talk about the time, how it is experienced by marginalized people, how long it takes to develop trust and work with them to empower, it's a very, very different indicator for them, and it takes much longer. Then we can say that another moment to reflect, and it was already mentioned, is that participation of the workers or organizations in the lives of people so much often predetermined by project or plan. And that means actually that to develop a dialogue and participation with the people is very hard, sometimes maybe impossible. And it's one of these challenges which Thijs noticed, which noticed that we should address to and think how it can be changed. Because according to the project lines, we can really only sometimes multiply confusion and contribute to social injustice. And what's very important to think about and take into consideration, and again, it has been already mentioned, is that basically when we are talking about our practices with people, we would say that we help them to develop their voice and their own agency. And in this way to acquire power to change the things which they find as oppressive practices towards them. But this also means for the practitioner that he becomes accountable to the service users, to the local groups. And in this way, it very often may be disruptive to organizational accountability and culture. So it's quite a challenge which we are also kind of facing in our work, and should be very aware and think how a resistance to this pressure can be built, because otherwise social workers find themselves quite challenged and stressed in the work that they are doing with the people. So these are just a few considerations, but I hope that they will help you to develop discussions about the learning, and also angle which we can take when we are thinking about including research as a part of professional practice, and connected it to our own commitment to be in the field with the marginalized people. Thank you so much for your attention, and I will stop now.
Thank you so much, Oksana, for your very interesting input. Just as a comment in the chat to your presentation from Varpo Viens, he says, people-centered inclusion, empowerment, identification of resilience building issues, and co-development. These were things that came to my mind from Oksana's excellent speech.
Thank you so much, Lina.
So there is no possibility for all of you to write questions in the chat to all the last three presenters, if you have any. But I could probably start with one question to all